Hey guys, it's Dr. Justin Marchegiani here. Happy Friday. We got a live Q&A in the house, so I look forward to going through and answering a whole bunch of questions for everyone and make sure everyone's taken care of here today. All right, so off the bat, let's kind of just dive in here. One question here off the bat: since I consume real Himalayan sea salt instead of table salt, is it necessary to supplement with iodine? If so, how much per day? So, I mean, it depends, right? Different sea salts are going to have a different amount of iodine. I think about the RDA of iodine somewhere between 150 to 250 micrograms. So, obviously, your big sources of iodine are going to be seaweed, right? Kelp, those kind of things. You have smaller sources in egg yolks. So, if you're doing things like egg yolks, if you're taking a good multi, like in my multi support pack, I think we have 150 to 200. We have 100% of the RDA in there. So that's kind of like your insurance policy. And then if you're eating some good, healthy kind of paleo templated foods, you're going to get a little bit more on top of that. And then if you need more on top of that, we recommend dialing it in very specifically, very small at a time, just because increased iodine can dump bromine and other halides that may be an issue, or it can also drive up thyroid antibodies. So I really like to be incredibly careful with adding in iodine because of its increase in hydrogen peroxide in the cell and its ability to increase thyroid antibodies. So if we do it methodically, we do it slowly. I have a liquid iodine support product that I use. It's 100 micrograms per drop. And we typically will gently increase that up weekly and see how we do. So ideally, good multi with a good foundational RDA level, healthy diet that will give you some extra on top of that. And then if we need to supplement on top of that, we can do it very methodically with a sublingual or liquid potassium iodide. Hope that helps. Dylan writes in, what do you think about a glutamine loading 50 grams a day when healing a leaky gut in the initial phase of healing? I think adding in really important nutrient. In my GI Restore, we have that there. People that are more sensitive, that can't handle maybe some of the herbs, will throw in glutamine by itself for sure. Some people that are more inflamed or more sensitive will convert that glutamine to glutamic acid or glutamate, and they can kind of get brain foggy or inflamed because of it. Most people I find tend to do great with it. So I have no problem adding in glutamine to help with the intestine healing. The enterocytes in the gut love it, and it really helps the recovery and the healing there. Let me dig in here a little deeper for you guys. Okay, awesome. Since I can, let's see here. Gupta says I eat some seaweed. That's good. I mean, you just got to make sure the seaweed is it's good quality. I mean, you just got to be careful. The Fukushima accident with the radiation back in Japan in 2011, you just got to be careful with the quality there. Hope that helps. Let's see here. Hello, Dr. J. Got a question about bunions. Is there a way to get rid of it? I got a bunion on the side of my feet. So first off, bunions basically is kind of almost like a calcified kind of growth in the side of the foot. Typically, there's going to be some kind of force absorption issue. So biomechanically, your foot may be striking in a way that's not distributing the force evenly. So number one, I'd want to see a really good chiropractor that does a lot of extremity adjusting that can make sure that the feet and joints are really moving properly. And if there's any soft tissue issues, to really work that out so the joint can actually move properly. One of the things you'll see with bunions is a lot of them can start in the hips, because the hips, so here's like the side, if here's your foot, right? Bunions tip happen on this, like the big toe inner joint there, and they have to come in there and shave it off. If you look at someone's knees, right? These are my knees. What happens is as they start to pronate, meaning as they go in, right? That shifts a lot of the weight on the foot, right? As knees go in, then the pressure on the side of the foot increases, right? And a lot of times the knees go in because of like weak glute medius muscles. So the hips, that gluteus medius muscle helps keep the knees like straight. And when the glutes get weak, they will bend in. All right. They will bend in. So you got to get those glutes worked on, glute medius worked on, some soft tissue work, those kind of things. Myofascial release, ART will definitely help. Does coffee take you out of autophagy? Again, there's not a ton of calories in coffee. There's some alkaloids and some nutrients in there. I would say you're probably okay because there's not a substantial amount of food or protein in there. So I think it's okay. And then also it increases free fatty acid synthesis as well, which is great. So part of the whole fasting benefit is you're recycling some of that protein and you're really tapping into that fat, right? You're increasing ketone production. And again, coffee is shown to increase that. So I really have no problem with that. So a couple more things here. One of the biggest things I want to chat about is allostatic load. Okay, allostatic load is nothing more than your stress bucket. Imagine this being my bucket. Each little ball I pick up, we put it in that bucket. That's a stressor. It could be an emotional stressor, and people could have multiple emotional stressors. It could be a financial issue, a work issue, a relationship issue. All those things could be present. It could be someone's diet, and there could be multiple things. There could be blood sugar issues, inflammation issues, gluten sensitivity. There could be infections. There could be leaky gut. And when I work with someone, I'm kind of making a mental audit in my brain of all the different stressors, kind of lining them up. Some people, let's say they have 8 or 9 or 10 big stressors. If I knock off 2 or 3, we start seeing some improvement. 4 or 5, we start seeing some improvement. People that are more chronically ill, it's like you have to get almost all of them knocked out before you start to see improvement. And then that healing starts happening slowly. So for me, I always, when I'm with patients, I'm always, what are our wins? What are our challenges? What's going good? What's bad? Where are we at with the diet? Where are we at with supplements? Where are we at with lifestyle, sleep, hydration, emotional stress? And I'm kind of seeing, as we knock things out, how do things improve? How do they progress? And that's the hard part, because some patients, they just don't want to stick around long enough, and they just have to understand that they're going to be more on the sensitive side, that we need more time. We have to hit more of those allostatic stress balls, pull them out of that stress bucket, and we need more time for that healing to happen. So just keep that in the back of your head. So we're always looking at that stress bucket, our inflammation bucket, our allostatic load bucket, and we're trying to pull things out. And of course, people don't understand that diet. They think their diet's great if they're all eating the food pyramid, or they don't understand about infections. And these can be hidden sources of stressors. People can think, hey, I'm eating my 11 servings of grains a day. I'm eating my carbohydrates. I'm doing a lot of my aerobic exercise. I'm, doing whatever else. There could be a chronic infection present, and they don't understand that these are hidden stressors. Just because you think you're doing a good job or you think you're healthy, you may not be, because what we've been told about food is not necessarily correct. Let's keep on rocking through here. What main supplement do you think Tom Brady will rely on this weekend to perform at his best for victory? Great question. So I've studied Tom a lot. I'm finishing his book, TB12 Method. I'm going to try to get Alex Guerrero, his trainer, on my podcast here soon. So, a couple things that Tom does. Number one, he's all about muscle pliability. So he's doing lots of work to make sure his muscles are pliable. He starts off his day with lots of hydration and minerals added to the water. So extra electrolytes in there. His whole philosophy is, well, one, electrolytes help with the nerves working better, which is, when you're doing complex movements and activity, you want those nerves to communicate well. Number two, it helps provide muscle pliability. The more pliable the muscles are, it's like a nice fresh tenderloin over beef jerky. Beef jerky is tough, hydrated. It can absorb force as well. That's why it tears. A tenderloin's like a sponge. It can soak up those things. So he's going to be doing electrolytes, hydration. More than likely, he's going to be taking amino acids. I know he does whey protein. I think he also does branched chain amino acids and creatine. So imagine he'll be doing that to help provide a anabolic environment for his muscles to heal, and extra amino acids in his bloodstream to also be available. He's probably taking B vitamins, probably taking a good multi as well. I've read his supplement section in his book. I know he does a lot of alkalizing, like vegetables. So he does like a green drink or some dehydrated greens ground up. So I think those would be the big things that he would be doing. Again, there may be things he's withholding from the public because they've really helped him. He doesn't want to give people an advantage until he's done, right? So those are the big things I think off the bat here. Hope that helps. Why does heat destroy vitamin C? I'm not sure what you mean. Like, you mean like in vegetables or cooking things? Again, a lot of times if you cook a vegetable, right, if you steam it or saute it, you can actually increase nutrient availability because some of the nutrients are trapped in the fiber. And if you break that fiber down a little bit, that can help actually increase nutrition in vegetables. So I'm not sure that's necessarily true. Again, to what degree are we talking about? I can't find dark chocolate without traces of milk. What do you think? Traces of milk would be a problem. Again, it just depends. If you're doing in the 80% dark chocolate range, you're not going to have a problem with milk. I like Endangered Species brand. I like Green and Black's another good one. I like Lindt. Those are pretty good as well. So those are all really good options for you. I'm about to have my dead root canal tooth pulled out. Which natural antibiotic supplement would you recommend instead of conventional antibiotics? I would be gargling with hydrogen peroxide silver daily. I would be taking silver. You could even take some gel, silver gel, and rub it right on that root. You could also get some really good neem toothpaste, and then you make sure you put that toothpaste. You can rub the toothpaste in there and just, really brush your teeth, let the toothpaste sit in and around the gums. I think that would be phenomenally helpful. And of course, some extra probiotics around that. And, get a good dentist that's biologically trained that you can ask those questions to. But I would do the silver. Silver is going to be really good. You can also ask for some ozone gel, is also great as well. Have you tried Tom Brady's sleepwear? It's supposed to have an infrared technology to repair during sleep. I've been thinking about that and trying them. Yeah, I definitely looked at it. I'm going to be ordering his band set today. I think the bands are really interesting regarding his exercise. I mean, I'm changing my workouts. I haven't been working out as much, just on the weekend, water skiing for a couple hours, and I walk about 6 to 10 miles a day. And then I just try to jump in here and there during the day sporadically to do push-ups and kettlebell swings. So I haven't been doing enough, but it's 80% diet anyway. So that's kind of where I fall back on, is the diet, but I'm going to try to get some of his bands as well and just try to break my day into like 2 15-minute workouts, one in the morning, one at night. That way it's really easy to slip in there. But the sleepwear, I am really, really interested with that. And I think I'll be purchasing some of that too. How do we get rid of acne on the back? Again, acne is going to be a result of gut and detoxification issues. You have to go work on the gut and your detoxification pathways. Who's Tom Brady? He's the GOAT, greatest of all time. I mean, you got to study his story. I recommend watching the YouTube video series or Facebook video series called Tom versus Time. Tom versus Time. It goes over who he is, who he was like growing up. Not a super athletic dude, not your prototypical athlete. Worked hard, using lots of natural medicine, functional medicine, kind of paleo nutrition, and body working techniques to be at the top of his game, even in his 40s, which is unheard of, being in a contact sport like the NFL. Do you recommend doing a 201 car test before retesting with the GI map? Hey, Riley. So regarding your situation, typically my story is if someone has infections, I always want them to be infection-free before we retest the adrenals, because there's an obvious stressor there that's still on the system, creating a stress. So I don't want to do that until that's fixed. Think about it as like, I don't really want to be comparing my water bill, until I actually get the leaky faucet in my guest bedroom fixed, right? So think of that as your leaky faucet. Let's get it fixed, and then we can compare efficiency and pricing or your adrenal health after. Hope that makes sense there. I have chronic eczema. Been really inflamed as of late. Then I cut off coffee and the redness is gone. Why is that? Great question. So in general, more than likely, there's an allergy going on with the coffee. Okay, so that's a really good sign. That's why we'll cut out coffee on an autoimmune diet, because just in case that could be a vector, we at least know. So it sounds like, Connor, you're doing an autoimmune diet, and if you're getting benefits there, that's phenomenal. Let's keep on going with that and keep me posted. So keep that out. There's some kind of autoimmune component there with it. Let's see here. Any supplements and tips on preventing injury with lifting weights? Yeah. So number one, you can do interval training. I think the word's interval training, or super slow training, where that contraction is going to be like about a 7-second contraction. So like a 3 to 4 second lowering phase, a quick pause, and then a faster concentric. So about a 6 to 7 second contraction. That way you take all the momentum out of the injury. So typically injuries are going to happen with poor form and a combination of people using momentum to get the weight up. So if you go slower, you can be more focused on form. And then number two, you're not going to use any momentum to push the weight up. So common ones, like if I go heavy in deadlifts and I'm coming down, I really go down like a second lower, and I have just a gentle touch and then go up. People hurt themselves when they go too heavy, too fast, and they bounce the weight off the bottom. Because as they bounce it, the weight comes up, they start going up, and then the weight hits down again, and then they don't have the ability to absorb it, and they get some micro tears. Or a disc issue if their form's really bad. So that's a good way to do it. And then also, like Tom Brady, just doing exercises that help with muscle pliability. So the bands are also really helpful too. I think you can do some really good stuff with the bands or TRX. Just start with a weight that you own, like 15 reps, 12 reps, keep it there and start dropping off, stop when you're within 1 to 2 reps of failure or when perfect form starts to break down. Hey, Sherry, Dr. J, is a root canal not the route to go? My dentist says I can't get a bridge because of the 2 teeth surrounding. Yeah, so this is the problem with Facebook. So try to join me, guys, on YouTube because Facebook cuts off the comments after like 2 sentences. Like I just can't see the whole sentence there. But regarding root canal, I would make sure you're seeing a biologically trained dentist. Hal Huggins trains them. You can go to IAOMT.org. I would trust what they're saying. Dentist says I can't get a bridge because of the tooth. Yeah, I just can't read it. Sorry. If you can write it again. The last word I see is surrounding. If you can just paste the rest of it, and that'd be helpful. But I would go and base my decision off of what they're saying. And if you have some intuition saying something doesn't feel or seem right, I would get another referral. I know you're in Silicon Valley area, so there are other people in that area I would look at as well, or even just reach out to some people via online and just send them over your x-rays and see what they think. Okay, here. Do you treat pets? Yes, I see a lot of animals that have infections. So we'll treat them either with herbs or probiotics, or we'll even get antibiotics sometimes because, it's hard treating animals, getting them to take herbs for long. So sometimes we'll do antibiotics to knock out an infection, especially if that's a vector of the family getting sick. My 6-year-old son gets night terrors and sleepwalks. Probiotics seem to help diminish his episode. Is there anything else that can help him? Yeah, well, make sure his diet's fixed, paleo template, or make sure he gets a gut test. He probably has some infections. What causes terrors? I mean, again, for me, I will get I'll talk in my sleep or have bad dreams or kind of sleepwalk myself when I, number 1, consume gluten, or number 2, consume not so nice alcohol or too much alcohol. So again, if your son's 6, probably not going to be the alcohol thing, maybe the gluten thing, and probably the parasite thing. Let's see here. What are the effects of cocaine on the brain? Cocaine is a stimulant, so it's jacking up dopamine. Almost every reward center around kind of action, right? Whether it's checking your text or going on social media or eating sugar, it's primarily to increase dopamine. That's the feeling we get like when we're in love or in a new relationship. It's like, oh, that your brain is just bathing in dopamine. So that's pretty much what cocaine's doing. And it's also probably going to be increasing adrenaline too, because it's going to be a stimulant. So probably increasing adrenaline and increasing dopamine. Hope that makes sense. Let's see here. Okay. Dr. J, are you offering free tickets to Paleo FX for some of your favorite patients? Hint, hint. It's a great question. If they can give me some free tickets, I would definitely offer them. So I'll have to see what we can do. Do you recommend taking breaks from taking all adaptogens for a few days or taking on a regular basis? I think it just depends. I think rotating, having some rotation component for sure. I think if you're going on vacation and you're in a stress-free environment and you're chilling out, I think that's a great time to not take them. So that's a good place if you were going to try to pull them out. That's where I recommend. Is chronic eczema an autoimmune disease? I am 26. Last year, I started having RA, like pains in my fingers, and have become worse. Yeah, it is. It definitely is an autoimmune disease. So an autoimmune template, an autoimmune diet is going to be absolutely essential. Treating candida for 4 months with no results. GI map came back clean. Still have digestive problems, nail redges, and brain fog. I would make sure HCl and enzymes are sufficient. If you're still having problems breaking down the food, I'd make sure your food's cooked well, maybe even do a GAPS approach where things are in a crock pot type of environment. And I would make sure there's no other underlying issues. So if it's still coming back clean, do you have digestive symptoms still? And number 2, I'd probably look at doing some sea breath testing just to see if anything else is going on from a gut bacteria perspective that's not being picked up in the GI map. See here. Okay, I think we hit all the major questions. Someone's trying to Skype me here. I got a podcast in just a minute. I'm not sure if it's a podcast that someone's going to be on my podcast or I'm going to be on someone else's. So if someone's going to be on my podcast, I will be back up in like 10 minutes. So be there, be square. Hope everyone has a fabulous Friday. Again, give me a like, smash the bell, smash the subscribe, give me a thumbs up or a thumbs down. Either way, I appreciate the feedback, and you guys have a phenomenal Friday. I'll be back here on Friday and back here on Monday with Evan Brand for a live podcast. You guys have a phenomenal weekend. Thanks.